We have everybody at the table ready to go. Good morning. We are starting now on page 7 with the Department of Social Services, and this item is Federal Fostering Connections to Success Act and State Program Improvement Plan. It's an increased cost of $4.7 million in the May revise. I would ask if there was, page 7, a motion, but obviously we can't entertain one. I think in this one we're going to be looking for some different options, so if I could have the LAO start off with maybe what our options are here.
Thank you, Madam Chair. Min Sun Park with the Legislative Analyst's Office. As you noted, this item really covers 2 separate issues, so I'll try to comment on each of them separately. The Federal Fostering Connections to Success and Increasing Adoptions Act was signed into law in October, impacting many provisions in child welfare programs. The state actually has several of the new federal requirements already in place in some areas, but there are also new federal mandates and some areas where the state will have to expand on what we're currently doing. As such, the administration is proposing a total of $12 million, of which $5.7 million is general fund in local assistance for counties to implement the federal act. We think this is a reasonable amount. The administration is also proposing 10 positions for the Department of Social Services to implement the federal act. And while we do think that there are new workload, new federal requirements and some expanded workload, we don't think there's enough to justify 10 positions for the department. So we are recommending approving at most 4 positions for DSS and having the department absorb any of the remaining minor workload increases. For the Program Improvement Plan proposals, the PIP, these are in response to the recent federal Child and Family Services review of the state's Child Welfare Services Program, which the state failed on all outcome measures. The administration is proposing a total of $26.6 million, of which $15.5 million is general fund for counties to implement some new provisions to sort of improve on child welfare services. Given the state's exposure to federal penalties of over $100 million, we think that this is a reasonable request.
Questions, members? I just want to comment that, again, new activities I think are going to be very difficult for this committee to approve. And again, new hires are extremely problematic when we furloughed our current workforce. And one of the things I didn't mention yesterday, but I will now, is that the difference between new hires and existing employees is with a new hire, we incur all of the additional expenses that go along with that, including all the benefits that we have to provide. As opposed to using existing employees that are on furlough who, we're already paying those benefits for. So looking at the number of new employees that are being proposed here to implement new activities, I'm just not in favor of. And the Department of Finance can comment, and perhaps other folks have questions or comments too. I do want to mention, since we have now a number of members here, we have a really, really aggressive schedule today. I would like to get through 4 separate agenda items, and I had the list, but now I've lost it, of course. Human Services, Public Safety, Local Government, and Revenues. So we're going to try to get through all of those today with everybody's cooperation. So with that comment, Mr. Cheney, did you have a comment or a question? And then Department of Finance?
Well, you want to do finance?
Okay, go ahead.
As the LAO mentioned, Madam Chair, thank you. As the LAO mentioned, this is new required workload for the bulk of the request, and as such, in light of reductions sustained at the state level, we think that we need additional resources, both at the state and at the local level, in order to perform this workload.
Well, let me, 2 different questions. I mean, one is this number of people. How many vacancies are there at DSS right now? I bet it's more than 4.
Nick Buchan, Department of Finance. I don't have the exact number of vacancies at Social Services. Yeah, I can tell you they're running a higher than usual vacancy rate, and that's primarily due to the impacts of the executive order last year that did freezing on hiring, and that coupled with just subsequent reductions from year to year. So they are currently running a higher than.
Well, I guess what I'm trying to figure out is why would add new positions rather than filling vacant ones?
The bulk of the vacancies are going to be associated with salary savings, so it's an issue of not having sufficient funding to fund the number of vacancies the department currently has. So, if I think if the committee was to approve the funding for the positions and not establish a new 10 PYs but provide the funding, I think that would allow the department to look at shifting some of those existing vacancies. But most of the vacancies are salary saving vacancies, so they're positions without money that goes along with them.
Interesting problem. I don't know. I mean, the most I do is the LAO recommendation, but I'm worried about the overhead thing. And then in terms of the actual money here, we had thought perhaps there was some savings available that we didn't need necessarily all of this. And I'm a little sensitive to the notion, though, that we are out of compliance and that we could be facing these humongous penalties. And I'm also concerned that just beyond the penalties part of it, that our system, what is it that we're not performing? What are the kinds of markers that the feds said we're not meeting?
Yeah, I believe that for the Child and Family Services Review, as I mentioned, for the Federal Child Welfare Services System, we failed on all of the 7 outcome measures. I think the areas where we're having the most issues are some of the permanency outcomes, and that's sort of where the PIP proposals are trying to implement new premises at the local level to try to improve on permanency for foster care children.
Senator Cheney, we generally, the way in which this review is structured, we tend to be in good company with many other states that are also failing the reviews. It's in some ways assessing, looking at where the program is. It's consistent with our shift to an outcomes-based system for child welfare services, and we enter into these program improvement plans where we set new targets for how much we're going to improve relative to the goalpost as it's been established. Given the sensitivity of the program and what we're trying to do, the federal standards are very stringent, and generally most states are not meeting the standards, but we're working towards improvement.
Well, but I mean, so could we work towards improvement with, let's see, in the other 3, the local assistance item, we have $5 million. No, wait a minute. What's the? Oh, there's 2 different. The 3 things that are listed here, the health oversight, the participatory planning, and are those all related to FSCA or to PI?
The health oversight that's listed is related to the Fostering Connections to Success Act, and the 2 other items are for the program improvement plan.
And so the program improvement plan is the one that helps us avoid the penalty?
Yes.
Yeah. It's basically we negotiated with the federal government. We talk about the specific things that we are going to do as a state in order to improve our outcomes in the different areas, as the LAO
And what are we
noted.
going to do that costs $15 million, $18 million in the relative search and engagement?
My understanding with participatory case planning is that it's providing additional funding for counties to have families engage in some of the case management work, or I'm sorry, not case management
But are we
work,
funding KinGap and some of our other base programs that actually help on this, or are we shortchanging them and then doing this new thing?
No, this is an augmentation to
No, I
child
know this is
welfare
an
services.
augmentation to this, but there are other elements that have been traditionally the ways we did this. Adoption assistance, KinGap, that I think the governor's proposing to cut.
And even under our proposal to eliminate CalWORKs, KinGap would be fully funded. So
Our proposed reductions in the child welfare and foster care area are rate reductions to foster family agencies, rate reductions to group homes, as well as a reduction to the child welfare services based funding.
So we're going to cut 10% out of child welfare services and then say we're going to improve outcomes because we got this new idea?
These are particular things included in the program improvement plan negotiated with the feds for particular activities that counties will be doing.
But without the social welfare workers in the other piece, I'm not sure how they would do that. How much is the CWS cut?
70.6 million general fund.
70?
Yes.
Oh. So this 20 wouldn't help a lot, but it would help some. I don't know. I mean, I'm concerned about meeting the goals. I'm concerned about doing something to improve outcomes. I'm not quite sure I'm prepared to spend, what does this come out to, $20 million general fund, and $22 million general fund and 4 positions to do it. I don't know.
Well, we have a staff recommendation that I would recommend we seriously consider. It would reject $1 million general fund for health oversight, reject $1 million general fund for case planning, and reject $1.5 million general fund for relative search engagement, and reject $983,000 for 10 FCSA positions for a savings of $4.18 million.
I'm trying to get more here. I'm tempted to let some other folks. What do you? You're the county soup. What do you think? You're the county soup. What do you think?
Well, I'm ready to
That's
take
okay.
the recommendation at this point. Looks like some others
Yeah.
are.
I mean, I liked your comments about the furloughed workers, and it's very difficult to justify this when we're furloughing folks at the same time. So I personally like the LAO's recommendation.
I don't know. Let them. I just want them to be properly briefed here. I was thinking, members, I don't know, that even a little more savings than the chair's proposal, which I'm okay with, but maybe the health oversight one, just gets delayed, and the planning, take it down the way we proposed. And there's a bill, I understand, on the health oversight issue that's moving anyway
Yeah.
from the Assembly. That's why I wasn't aware of it.
Right. There are several bills in the legislature, I believe 8 or so, related to the federal Fostering Connections to Success Act that's moving through that.
So are those bills related to these items, or could we just fund them through those bills and not, or the health oversight you could, I'm told. Is that, anybody else believe that?
You could include an appropriation in a different place. This is federally required workload, and the question is through what mechanism. I mean, a question is through what mechanism do you want to fund the federally required workload?
Mr. Blumenfield has a question.
Yeah.
Since it is federally required, you are going to do it. So if you don't have the money to do it from this budget item, how does it get done? These activities, for purposes in terms of the health oversight, we're talking about public health nurses at the local levels. So this is workload. Generally, the bulk of the funding here is funding for counties to do work on as the state's agent for child welfare services. Presumably, this would be a reduction to counties, and they would have to absorb the workload. If they can't absorb it, then we would be out of compliance with the federal requirements. This particular expenditure has a match of 3-to-1 federal funds.
On the other hand, if I child welfare services at the county level as much as you're proposing, because we had some savings here to do that with, there might be some social workers available to do the work. I don't know.
In this particular work,
child welfare workers?
This particular work is done by public health nurses.
So what are they oversighting? What are they oversighting?
My understanding is the federal law requires some collaboration, health oversight for foster care children, and requires collaboration with the Department of Health Care Services. The administration is proposing to use sort of the existing public health nurse system that we have for foster care children to provide that oversight. So we need to coordinate and provide, make sure that foster care children are receiving and meeting their needs for mental health and dental needs are being met. So they're proposing to use public health nurses to do that.
Why don't we do that now with the basic child welfare system?
We currently fund public health nurses in different areas of the state. I believe that it started with Senator Alpert legislation, if I remember correctly. But we fund public health nurses, and they work to make sure that youth are receiving the services, and that there's coordination across systems, that they're getting the coverage that's provided on their Medi-Cal for them, et cetera. This brings it statewide, consistent with the federal requirements.
So the other program is not statewide yet?
No, I believe the existing program, there's enough funding to sort of provide some health oversight for initial foster care children, or initial entries into foster care, those children, but this is providing it for all foster care children statewide.
Just broadens the existing investments on public health nurses, consistent with
And what does the
federal
bill
law is.
then that's moving do on this issue? Does anybody know? Oh. I held an assembly approach. Where's Leon when we know? Pardon? I don't know what to think. All right, well, where are you? I don't, just wait to hear from somebody else around
Bob
here.
Garcia from the department. In terms of what the bills do, they change state law to comply with federal requirements, and this provides a funding for those changes in state law.
Okay, and given that that bill appears to be dead at the moment, then how would we use
Well,
this money?
if the bills required to implement these federal requirements are not passed, then we will be out of compliance with federal law and potentially jeopardize our Title IV funding.
Okay, so the bills need to pass, so we need the legislation to be in compliance, whatever that legislation is, these 8 bills she talked about. And
Yes.
then we'd have to fund them, is the flip, and this is the theoretical funding for the bills that are.
Right.
So we'd have to write them as trailer bills? If those bills don't.
Yes, I believe we would just move the language from the bill to trailer bill language.
Does anybody know? Where's Mr. De Leon? Mr. Nielsen, do you remember hearing these in appropriations? Yeah, well, and our concern is that the bills that they're referring to that we'd be funding by this action appear to have been held in your committee, and we're trying to understand whether we're moving that stuff or
And
not.
I do not have the our suspense
Sorry.
calendar.
Sorry, no,
I
I
don't know
just-
if our chairman would even.
That's why he got here late, that's why I was picking on you.
I would defer to our vice chair on that issue.
There were an awful lot held on suspense.
Oh,
I
okay.
assure
There are
you.
bills moving on everything that's required, somebody else tells me from I don't know where. Okay, well, I don't know. I could live with that proposal. I just think we shouldn't spend any more than we have to on new things. And it bothers me that our existing program is not doing, I don't know, what if we cut them all in half? Is that more?
Well, that's less savings.
I mean, you're not going to spend it all
That's
in
less
1 year
savings than
anyway.
what-
No, it's
what's
more
being
savings.
recommended.
No, it's more.
We cut it in
Madam
half?
Chair,
Yes, 1.5.
Yes, Mr. Leno?
This one would be 1.5.
I think the points you've made relative to our furlough situation are appropriate, and I'm following Senator Cheney's concerns as well, but there is real risk. We've already experienced some significant fines. Can you share with us how much we put out in recent years?
For the CFSR penalty, we paid $10 million, I think, with interest. Is it 9.99 million?
And where does the 107 figure potentially loom?
So that's the potential, the total risk, the maximum risk for the state. I think previously the first Child and Family Services review that we failed, the first round, there was also a potential risk of $100 million. But through investments, the state was able to meet some of its program improvement plan measures and bring that penalty down to $9 million. So the $100 million that's listed in your agenda is just the maximum penalty risk.
What do you think is actually more likely?
I think it depends sort of
If we
on-
didn't take action, if we didn't support this?
It's difficult to say.
Yeah. So the point being that these risks are real, and we're also impacting our foster youth in the process. That's who's being failed as we get fined for not performing. So I think your suggestion of slightly trimming in each of these 3 categories, along with the rejection of those 10 FCSA positions is probably a reasonable place to go. We'll gather about $4.5 million in savings relative to the proposed expenditure, and at the same time be meeting federal requirements and potentially keeping those fines at bay. So,
would you like to make that motion?
well, I want to make sure that Senator Cheney is comfortable
Well,
with that.
the other thing I was going to recommend, because the Vice Chair's concern is trying to find more savings, is that we could adopt this action now and direct the staff to look at this again and see if there are more savings to be found without jeopardizing any further whatever federal mandates we're under.
Well, at least the 4.5 would not increase the current Budget Act amount. It doesn't add in the May revise, so that, I hadn't thought about that. So that's one of the advantages of that number.
And
All
Madam
right,
Chair, if I
okay,
may
look at that.
clarify on one thing, the health oversight component, the things that are federally required affect base 4E funding, then the program improvement plan relates to the penalty. So there's two separate issues. One is what are the things that we have to do to be able to continue to receive the base
receive
federal
the money.
fund,
Okay.
and then the other one is the issues associated with the review and the associated penalty.
Okay.
I would just add, just to follow up on Finance's comment, I would just add, though, that the requirements that the feds have for us for health oversight isn't necessarily having public health nurses do these particular functions. It's just that we need to provide health oversight for all foster care children and work with the Health Care Services Department. So I think
It
that
would help if we didn't cut social workers to do that.
Madam Chair.
Right. So I think that this particular proposal is the administration's proposal to implement that
I
requirement,
understand.
but it doesn't have to be in this format.
Okay. Did
Mr.
Neal?
Blumenfield?
Yeah, I think what we're struggling with, it's obviously a very important purpose what these functions are, but we're asking everyone across the board to do more with less. And when it comes to the administration doing more with less, it's hard to say, well, only these people can do these functions. I mean, it's partly there's a lot of flexibility. Why can't current workers do it? Why can't you mix around the workload and get it done? I mean, we're asking in-home service workers to do more with less, and everyone else. And I just don't know why you can't do it within your current budget and move things around and assign other people to do some of this oversight.
And Mr. Blumenfield, the vast majority of the resources, with the exception of the 10 positions, the vast majority of the resources are resources to counties to be able to perform these functions. So it's not resources to the State Department, and it's our judgment that in order for the counties to perform these functions consistent with their work in child welfare services, they need these resources.
Yeah, but they still need base resources. I mean, it's just these things mix and match on us. We're cutting the same people in a different place, and that's what makes people crazy. I mean, I'm prepared to go with your recommendation
Okay,
if you want.
so there's a motion on the floor for that. We have some empty chairs here. So we'll record three votes in favor on the Senate side with 2 members absent who can add on, and on the Assembly side, 5 ayes. Thank you. All right, we're moving quickly here.
Madam Chair, I should tell you that Senator Walters won't be with us today. Her son is graduating, and so she asked me to extend her apologies, and it's not due to lack of interest, obviously, but with all due respect, her son is a priority.
I
thought we all could understand.
I find it objectionable and offensive that Senator Walters would think that a son's high school graduation would be more important than keeping company with us here today.
And we will relay that to her, Mr. Neela.
Oh, I already did.
No, I deeply appreciate how important those landmarks are, and it's nice that she can celebrate something positive in the middle of all this.
And we need to end on time today so that Danny can attend his child's 6th grade graduation, too.
Then that means we need to move along, because as I said before some of the members got here, we have 4 agendas we're trying to get through today: human services, public safety, revenues, and local government. So we've now spent a half an hour on the first page, which is good. We had a good conversation. I just want to make sure we don't do that on every page. So let's move on to page 8, creation of subsidized relative guardianship. And my understanding for a May revise savings of $1.4 million. My understanding is this will conform with whatever action we take in CalWORKS. So
You just told me King Gap was fully funded, except for the part that's in CalWORKS. That'd be a half.
Well, actually, Madam Chair, The Federal Fostering Connections to Success and Increasing Adoptions Act that we just talked about also gives states the option to provide kinship guardianship assistance payments with federal financial participation through Title IV-E funds. The May revision is proposing to create the new subsidized relative guardianship program to provide these payments with 4E participation. However, currently under the TANF Emergency Contingency Fund, which is created by the American Recovery and Reinvestment Act, CalWORks expenditures receive 80% federal funding, and KinGap is currently counted as part of the CalWORks program.
Part of the maintenance of effort in CalWORks right now.
Yes. So what we're recommending is to delay implementation of the subsidized relative guardianship program until the ECF funding stream is over, which should be October of 2010, because the ECF funding stream is 80% federal funds, whereas Title IV-E is 50% for federally eligible cases.
We're better off keeping it in CalWORks.
Well, it's really a technical adjustment because you would reject the $1.4 million here, but you would score similar or slightly greater savings from receiving the ECF funding.
But it's contingent on the CalWORks
Yes.
in terms of if we have a CalWORks program.
Yeah, I would suggest we hold this item open until we get to CalWORks. Next page, page 9, reduction of specified foster care rates for savings of $27.4 million. This one now gets us into the issue of the foster care reimbursement rates. Questions from members? There's a number of different reductions, and some of them I think are less problematic than others. We have a recommendation to adopt reduction to the group home and FFA, foster family agency rates, but reject the reductions to specialized care increment and supplemental clothing allowance, which directly impact the foster kids themselves and the families. So that's the recommendation that's before us. Discussion? LAO?
Yeah, we just wanted to add that given the state's fiscal condition, we think this proposal is reasonable. We would also recommend that the legislature consider additional savings of about $9.7 million general fund by completely adopting elimination of the supplemental clothing allowance. It's a supplemental allowance of $100 above an existing clothing allowance. And we would also recommend eliminating the dual agency supplement. That supplement is an up to $1,000 supplement to an existing enhanced rate for dual agency children who are both foster care children and who are served by regional centers. That would be an additional savings of about $5.4 million general fund.
What services wouldn't they get if you
It's
did
just,
that?
it's not really services. It's just that the supplement is up to $1,000. It can be $250, $500, $700, or $1,000 for children with extraordinary needs.
Depending on the needs of the family.
I'm sorry?
Depending on the needs of the family and the child.
Yes. We just feel that that's a supplement to an existing enhanced rate of over $2,000 for dual agency children. It's not a core foster care program. Room and board will still be covered with the dual agency rate. This is a difficult choice, but we just wanted to suggest eliminating the supplemental rates.
How did we create supplemental rates? Why do we have supplemental as opposed to base? What's in
the Budget Act for 7A established some changes regarding these youth who are dual eligible. So they're consumers that are receiving services both from regional centers and from child welfare services. And what had been happening in some regions of the state was that the payments that were being provided were actually at the group home level. The legislation established kind of a base rate that was in between the foster family home rate and the group home rate, and then provided there was some concern that that rate would not be sufficient to meet the needs of all children, so it provided an additional supplement that could be approved on a individual by individual basis to be able to meet those needs for children for whom the base rate that was established was not deemed sufficient.
I'm okay with the recommendation. I'm not taking away the clothing allowances and the families that are taking these children to help you meet the federal goals that you just talked about. If you to create stability and permanency in the families, I don't know why we would want to make that harder to do.
Well, this is a tough one any way you look at it. So that's the recommendation. Is there a
I'll move
motion?
it.
All right, we have a motion.
Sorry, to clarify the recommendation, I didn't hear seriously emotionally disturbed addressed.
I'm going to ask.
Oh, go ahead.
Does the motion include the clothing allowance and the dual agency, or does not?
It rejects cutting those. It leaves those alone, and it takes the rate,
rest of it.
Takes the rate decrease.
And for all of the different categories, all the
The
rate increase.
GH, the FFA, and the SCD, right?
Yeah, the SED is part of the group home
All right.
cut.
It's the three. If you look on the right-hand side of the agenda.
Yeah, I see 'em.
The left-hand side.
Left-hand side, sorry. It's the three. You take the big cuts and
First three.
reject the little ones.
Yes.
I just want to clarify, so the ones that we're rejecting are the cuts. I know that they're lesser in scale, but they're the ones that actually impact families.
Right. They go directly to the
To the
home.
children.
To the foster
To the family.
home.
Yeah.
Yeah.
Okay.
All right. So we have a 5-0 on the Assembly side and a 2-1.
3-1.
Just to
Oh, Mr.
clarify,
Dutton gave me a...
Yeah, but there's three of us.
3-1. Mr. Lowenthal is here
I want
on
to
the Senate side.
I want to clarify on that. That is not accepting the LAO's recommendation, and and accepting the governor's May revise to the extent of that would be a 26.6 million.
Right.
Is that
of savings? Yes.
correct?
Yes.
Now, I'd point out that the LAO's recommendation, just part of it, I think makes up the difference that we were talking about way back when we were talking about Hastings.
More than.
I've got more Hastings savings for you today, not to worry.
Oh, yeah, there's a few more coming up,
No
too.
alternatives have come up since.
Well, no, we've had several, actually. We've paid for Hastings about 12 times over with
Repeatedly, yeah.
actions yesterday.
In terms of additional cuts beyond the governor's
Yeah, because
recommendations?
they're LAO recommendations and things that we came up with, we've done. I mean, the difference between the governor and us on Hastings was $9 million. We did several $20 million things yesterday that were lower than the governor.
And there's more coming up today. So that concern may be...
But, I mean, it's worth looking at, but I think finance's explanation of how we got into this, why we have the supplemental rate, makes me uncomfortable with just throwing the whole thing overboard, which is, I think, basically... I don't know how many families, I mean, folks can look at this, Mr. Neela, Mr. Dutton, I don't know, and see if how many families would just say, you know what, I don't want to be a foster parent anymore if I don't get this supplemental rate. I mean, I think that's been the issue. These special needs children are the most difficult to place, could cause problems with that whole federal compliance issue. And to the extent that folks said, I'm not doing this because my family can't afford the extra cost, that concerns me. Now, if there's some way of looking at the thing and making savings by virtue of how you tighten up eligibility for it, or how you, how we distribute the supplemental payments, or how we think about the eligibility for supplemental payments, that might be something we could reconsider. I just don't know how to think about dumping the entire supplemental payments program and expecting some of these families to continue to provide the service.
Well, is there any way that the analyst could
wanna
come back
look
with
at
a backup suggestion that's somewhere in between? I don't know that this
I'm
makes a
open.
huge difference, and maybe it's not worth the time, but we need to move on. But
Yeah.
Could the analyst give us some figures in a short period of time? I don't know.
We can, you're
could
talking
explore that with
specifically about the
staff.
dual agency
The dual
supplement.
agency.
Yeah, we can look into that and come back to you. Our understanding is, I think the department is estimating that about 1,700 families would be eligible for the supplement. And like I mentioned, there are different tiers within the supplement. There's 4 sort of levels, 250, 500, 750, and 1,000. So we can sort of looking at eligibility for the supplement as well as changing.
I mean, if the
changing
staff group wants to talk with them and see if there's any room there, but for the moment, I would
Couldn't we
reject-
just move it and then maybe make
We're
an adjustment?
We're doing today, and if there's some new idea before Friday or so, give us a call. I don't know.
Well, we just took an action, so what I would recommend is that action be explored with a recommendation to come back.
Yeah.
Let's move on to page 9.
Yeah.
Excuse me, we were on page 9. Page 10, reduction to child welfare services of $70.6 million. Again, another extremely problematic one. Yeah. Members, our recommendation is to reject this proposal.
I just don't see how we ask counties to do this. Now, if you want to hold it to the broader county discussion, somebody, but I don't see how you meet those other goals taking these folks out.
Elio, could you address the actual loss to counties in terms of the employees that are administering these services? Because I think that's what we're grappling with here is, you know, this is a cut to counties and it's a cut to direct services in terms of social workers. Mm-hmm. Could you address that briefly?
Yes, Madam Chair. We have estimated that there would actually be an additional federal fund loss of about $37.5 million. However, counties could potentially draw down additional federal funds to the extent that they can provide overmatch funds.
From what?
So we're estimating that it would be a loss of about 670 to 750 social workers. I think it's similar. That's without the overmatch fund. So counties do provide some overmatch funds. I'm not sure what level they could provide in the current year. And I think that's similar to what the County Welfare Directors Association had estimated at about 660 social workers. We just wanted to add that we would also recommend rejecting the governor's proposal. We feel that Child Welfare Services is the core program that protects vulnerable children in the state, and an across-the-board reduction like this increases health and safety risks for children. However, we have laid out some targeted reductions to Child Welfare Services in our overview of the May report, so I can go over some of those.
Yeah, give us those.
Are those in the agenda somewhere?
No, they're not.
No, it was outlined in the options in our overview of the May revision report, so I can kind of quickly go over a few of them.
Okay.
So two of the targeted reductions to the core Child Welfare Services budget that we would recommend would be to suspend the hold harmless budgeting methodology, which means that we would decrease funding for counties with declining caseloads, and that would save $9.7 million general fund. And it holds service levels at the existing service level. Another option would be to cap social worker unit costs, which would decrease funding for certain counties that have larger funding allocations per case. And that would save about $4.4 million for total general fund savings of $13.7 million. And in our report, we also outlined some targeted reductions to non-core child welfare services programs, particularly those, some of the newer services for emancipating foster youth. So all of those would add up to an additional $29.9 million in general fund savings. So all of our reductions together, our approach would save about $43.6 million general fund.
What was the last one?
The last part I mentioned is targeting some non-core child welfare services programs, particularly some of the programs for emancipating foster youth. They're newer services, and we can talk a little bit more. I think further along in your agenda, THP Plus is on there, but we have...
Talk to your corrections people about that one. That's not...
Yeah. We also have some reductions to independent living program services, emancipating foster youth stipends. Those are state-only programs, so we wouldn't lose any federal funds in reducing or eliminating some of those services.
Yeah, those aren't helpful.
Okay, yeah, we looked at those before. And I appreciate your bringing them up. I would ask, though, if you're going to bring up another proposal that's not in our agenda, that you would give us a copy of it. I don't have it in writing here, and it's really, I listened to you, but it's really hard to, analyze it without it being in front of me and, accept some and reject others. But these, I think we have looked at before, and our recommendation was to reject them because of the impacts to what I would say our core services, and I would say that helping emancipated foster youth through that transition is a core service in my opinion. Yeah. So the recommendation at this point is to reject this proposal. Mr. Lowenthal.
Yeah, I want to go back to the LAO. If what the chair is saying is that's a core county service, we want to protect that service to protect abused children, to be able to have that 660 social workers still there, maintaining services. How much savings could we make? You said there are other things in this besides that.
Right.
That we could save. Could you?
The two targeted reductions to child welfare services to the core budget would impact counties, and for those specific counties, there may be a reduction in social workers. But the hold harmless budgeting methodology currently, the way we budget child welfare services, as counties' caseloads decline, we don't reduce their level of funding. So we're essentially holding their service levels. we're reducing the funding as their caseload declines in the budget year.
Right.
So that would save $9.7 million and impact 37 counties. So for those counties, there would be a reduction in general fund support for them.
But their caseload is dropped. Is
They're-
what you're
exactly.
saying. That's right. So there's not a
So-
reduction. So what you're saying is we could save $9.7 million without reducing services.
Correct.
So let me
Except
follow
for the
up
part
on
where they
that.
have to rehire everybody after the caseload goes up again next week.
But one of the reasons the caseloads are dropping is they're doing a good job of keeping kids out of foster care. So
Right.
I'm not really sure where if we cut that funding, are we going to cut their ability to keep the kids out of foster care?
We view this as, you should be budgeting for caseload. We've brought this issue up for years, that if the caseloads are declining, there's no reason to essentially do the hold harmless in an environment like this. The legislature has expressed over the years its concern that our whole funding for child welfare services, the number of social workers we have, may indeed be inadequate. And I think part of the hold harmless concept is, let's try to build that up.
Mm-hmm.
Well, and in better budget times, we understand that. It seems like this is a time where we would say at least make the call to make that reduction.
And I would just add that our recommendation is a temporary suspension of the hold harmless budgeting methodology for 3 years. And we do acknowledge that the legislature should come back and revisit sort of the entire budgeting system for child welfare services.
Okay, then what I would suggest, because that one makes at least some logical sense on the face of it, but again, not having it in writing here for me to look at, it's hard to say whether I would want to support it or not. I would suggest then that the committee reject this proposal and have the LAO come back with something that we can analyze in terms of reduction where there's caseload reductions. That gives us at least some small amount of savings. If we feel that it doesn't impact the ability to provide these welfare services to children, then I think we could take that cut. It's sounding to me like people would support that. But the important thing is to protect those core services to these kids. So is there a motion to reject this proposal?
Move.
All right. We have a 3-2 on the Assembly side and a 3-1 on the Senate side. All right, moving on to page 11, Reform of Adoption Assistance Program. This is an LAO proposal, I believe, for a savings of $2 million. So here we go. We're looking at new ones. So if the LAO could open on this briefly, please.
Thank you. The purpose of the Adoption Assistance, or AAP program, is to provide monthly cash grants to parents who adopt difficult-to-place children. Because of sort of broad eligibility requirements and relatively high grant payment levels, California's AAP program is one of the most generous of such programs in the country. It's also one of the fastest-growing children's programs in the state, again, because of caseload growth and increasing grant payments. We are recommending a series of legislative reforms to improve the cost effectiveness of this program, so I'll just quickly outline the 3 reforms that we have. The first is to narrow the definition of AAP eligibility. As your agenda indicates, the existing eligibility definitions include children who come from adverse parental backgrounds. This is sort of a catch-all category, especially for children under the age of 3, and it virtually makes all foster care children eligible for adoption assistance payments. We would recommend eliminating this category and making the program truly available to kids to children who are hard to place. This reform, for example, would make healthy children under the age of 3 ineligible for AAP, and we would just point out that many people do become foster parents to infants and young children as a first step toward adoption, so sort of this incentive through AAP may not be necessary for these families. The second reform would be to set grant levels by recognizing some parents' financial responsibility when they adopt children. Currently, the state is paying the maximum allowable AAP grant, which is the foster family home basic rate that the child would have received in foster care. So we're recommending capping that rate at 75%. And this cap would not apply to any specialized care increments or other clothing allowances and such that the family would receive. And the last reform would be to better tie benefit levels to need by eliminating the automatic age increases in AAP grants as children age in the program. That's the rate structure that's set up in foster care, and we just feel that these age-driven grant increases are not tied to demonstrated need. So we would recommend eliminating them, and any sort of changes in the child's needs should be reflected in the specialized care increment, which can increase over time. Altogether, these reforms would apply prospectively to new AAP cases, and there would be savings of about $2 million in 2009-10, but it would increase to $12 million in 10-11, and increase even further in the out years as existing AAP cases age out and new cases enter the program under sort of under the reforms.
So those who are currently receiving this assistance would continue to do so?
Yes.
And it would simply apply from here on out?
For new cases,
That
yes.
makes a lot of sense. Mr. Leno?
I think the suggestion relative to reform regarding needs-based makes great sense. So that's about 900,000 of your $2 million?
Yes.
How much is there in the category of reform relative to healthy children under 3?
For eliminating the adverse parental background category, that would be about 500,000 in 2009-10, but it would bump up to $4 million in 2010-11. For that specific reform, we're sort of estimating about over 30% of AAP cases qualify under the adverse parental background category. Some of those children, by eliminating that category, would probably qualify under another eligibility category. So we just assume that maybe there would be a 20 to 25% caseload reduction, because again, I think most of the kids that qualify in that category are children under the age of 3.
Thank you. So I'm not so sure about that second part. Minimally, that 900,000, I think we could go with.
That's, Madam Chair,
Mr. Cheney?
My sense that this has not been through any sort of stakeholder process or anything yet, and what you're describing on the bigger pieces sound like policy bills. At least in our house, we'd probably, as we did with the reorganizations and stuff, prefer that the policy committees kind of look at how to change the policy. I do think there's an issue with the definitions that needs to be resolved. I don't know that it's one we're prepared to resolve here on the policy basis. So, I mean, they're not necessarily things that we couldn't get the savings from, but it seems to me we need to have the conversation at some level. We're not going to draft that trailer bill. The 900,000 tying benefits to increased needs, that sort of makes sense. And I think that one's pretty straightforward. On the others, it requires the policy change to get the savings, and I just feel like the policy change perhaps needs a little more discussion than we're prepared to give it here. So,
well, a couple of comments. I thought the 900,000 was in 2009, 2010, and it grew to $2 million in 2010 and 2011. So
yes, that's correct.
Okay. So it sounds like everybody's okay with that. I understand the discomfort with making a policy change. I chaired Human Services for 2 years, and I believe you were, no? All right. And I've done a lot of work in the foster care and adoption area. And while I would have a level of comfort on a lot of these issues, sending them to policy committee, I don't think we have the luxury of having that time available to us. So my preference would be to take this action today. I'm seeing other people. Well, my preference is the whole thing. No. Oh, I'm sorry. Yeah, it's the tying benefits to need, right? Rather than that's what I was talking about, and that's what you were discussing, right? All right. We have a motion to do that, right?
But
it grows to $2 million next.
Dropping of the adverse.
The point, Mr. Nielsen, was to adopt the recommendation about tying the needs to specialized care and leave the adverse thing out until somebody else figures out how to write that bill.
But again, the savings are $900,000 in 2009-10, and it grows to $2 million in 2010.
On the benefit increases,
right? And it's only going forward.
What about the automatic grant increases? Are we?
That's the one. That's the one we're agreeing to. That's the one we're agreeing to.
The adverse. Getting rid of the adverse parental background category or not.
Right.
So the means test and the automatic increases, those are both, that's what we're doing?
Or is it one? Yeah.
So there would no longer be automatic increases. It would be based on need.
The benefit increases would be tied to need.
Means test and the automatic increase.
Means test as well, then?
Is that both or the 900,000?
Sorry to interrupt. We just wanted to point out that we're not recommending any means testing. I think the second reform we're suggesting is just a cap to the basic rate. I mean, we mentioned it should That reform is related to recognizing parents' financial responsibility, but there's no means testing involved. It's just a cap. Yeah, that's
But it's
not
a
allowed.
needs but the 900,000
Means
reflects...
testing is not allowed under
Under
federal law.
AAP,
Right, it's not means testing, but it's stopping the automatic increase just because of age rather than
Right.
need.
Yes,
So that's the one.
Right.
And, yeah, they'd be tied to need rather than to just, I got older and therefore I need more money for some reason. So that's the piece we'd be accepting.
And the cap, that's part of it.
Is there a cap on that? No, there's no cap.
No, the cap was the second one I mentioned, the 75% cap. I don't think that's part of the staff
What's
recommendation.
the 75% cap on what?
75% cap was one part of our proposal. Basically, instead of giving the full foster care rate, we'd only give 75% prospectively. That was another part of our reco. That is not
I
part
see.
of your motion. Your motion is
Okay, yeah,
restricted to
just sorry.
basically saying automatic increases no more. If a parent can justify through a process
Right,
saying,
the
my
need.
child had a special need, then they
Right.
would be able to get that.
No, that's the part, not the cap, because, again, we're back to the problem of if we don't allow, if we create disincentives to families adopting children, that's kind of not helpful.
Right. Okay, so we have the motion. I think we're all clear on that now. Senate, 4 ayes, and Assembly, 5 ayes. Excellent. Moving on to page 12. This is a legislative proposal, I'm told. Transitional Housing Program Plus, for an increased cost of $40.8 million?
Well, no, that's in the budget act. Madam Chair.
And it's a reduction, though.
We're suggesting a
for the
$5
May
million
revise of $5
reduction
million,
rather
right.
than, the LAO proposed a larger reduction. We're suggesting a $5 million
Right.
reduction.
So we need to clarify that because if the public has the written document, that's not reflected. So it's a $5 million savings in the May
Is
revise
the proposal, yeah.
for this proposal.
But it doesn't change the share of cost ratio with the counties.
To clarify, the May revision doesn't propose a $5 million reduction.
Right, I know.
Understand.
This is a legislative proposal. Right. But we've been asked if we have other proposals, so we wanted to make sure people understood this was a legislative proposal, not a governor's proposal. All right, members, what's your pleasure?
We'll move it.
Okay, we have a motion for adoption. Senate side 4-0, Assembly side 5-0. Great. Yay. I think we've covered the cost of Hastings just this morning.
We didn't cover the cost of the child welfare is the problem. We haven't covered the cost of child welfare.
Okay.
Add the rural hospitals in here, too.
Well, hopefully at the end of all this, it adds and subtracts up to something that we hopefully will balance. Page 13, elimination of state funding for community care license program for savings of $19.5 million. This is one that we just recently got the details on, so it's there is a recommendation to hold it open and explore some alternatives. Would the LAO's office care to comment, and then the Department of Finance?
Yes, thank you. The administration's proposal is to essentially reduce all general fund support for the community care licensing program by increasing fees, which would save about $9.4 million general fund in 910, and also reducing service levels, which would save an additional $10.1 million. So that combined effect is the $19.5 million general fund savings in your agenda. This would annualize to $39 million general fund savings in 2010-11. We are recommending rejecting the administration's proposal. This proposal would turn the CCL program into virtually a complaint-driven system, and that increases health and safety risks for the population served by community care facilities. We think it's really important here for the legislature to first consider what the appropriate service level for licensed facilities is, and then make the appropriate fee increases and/or program reductions. Our approach would be to retain the random inspection protocol, which is currently at a 30% random sample. It was at one point, it was at 10%. So our recommendation is to reduce the random inspection protocol back to 10% for daycare facilities and 20% for residential facilities. Our rationale for tiering the protocol is that for daycare facilities, there are parents and caretakers who visit those facilities on a daily basis, whereas the residential facilities, facilities may need some more oversight by CCL. We would also recommend a fee increase similar to the governor's proposal, but rather we would phase it in over a 2-year period with SRL for the department to report back on the impact of the fees on the supply of providers. So our approach in total would save about $8.7 million general fund in 9-10, and that would increase to $24.9 million in 10-11.
This is one of these things that I worked really hard on when I was chair of Human Services, and it was actually a bipartisan effort. Mr. Benoit and I worked real hard on the child care facilities licensing and inspections in particular. He had a bill that we kept trying to get through the legislature, but because of the increased costs, it was really hard to do. And my understanding from that experience is that the state is already only inspecting child care facilities on the average of every 5 years. So a child could, and many probably do, go through their entire time at a child care facility and never have that facility inspected by the state. And essentially what it does, by lack of enforcement, lack of inspection, is make the state's licensing system completely meaningless. What does it mean to be state licensed? We're not enforcing the standards. So this one really concerns me. But let's hear from the Department of Finance, and then Ms. Duchesne has some comments.
This is one of the many difficult reductions that we've been discussing because of our general fund condition. Basically, what we look at, as you've noted in 3.4, due to the general fund condition at that point in time, there were some changes made to the licensing program to institute a random sampling protocol. This is similar in approach in terms of we look at based on the general fund amount that we can support, what we think is manageable from fee increase side of the equation. Then we look at, based on the available resources, what are our greatest risks and what makes the most sense in terms of focus for where to invest our licensing resources. We prioritize criminal background check workload, and so both the front end criminal background checks as well as the back end wrap back reviews if there are subsequent convictions and investigations of subsequent convictions or subsequent arrests. We also prioritize the residential care facilities and those facilities where there isn't as much contact for the residents. So, for example, in a child care facility, while we would prefer to be able to have additional resources to be able to do more oversight based on our general fund condition, parents are there and there is more built-in oversight than there is a residential care facility. So we basically look at prioritizing resources, as the LAO has discussed, criminal background checks being our top, something that we would retain, complaint investigations being something that we would retain, the mandatory visits under federal law and those annual inspections would continue, and we would provide less oversight in terms of the random sampling side based on available resources.
Mr. Cheney, then Mr. Blumenfield.
I don't know. My initial note on the top of the page that I wrote with this one is realignment candidate, because I guess I'm concerned. How much does it cost us to be the state be the licensing person? I mean, to send people out and all this. My notes say that some counties do this already on our behalf, right?
Some counties we contract with counties for some of these functions. And
so when we contract with counties, how much are we spending versus how much we spend when we do it ourselves? One might want to look at that.
Yeah, we fund them at the same level that we'd fund the state program, and generally the counties do the licensing function. They tend to do the licensing function more around the foster care side of the equation, so for group homes, foster family homes, and FFAs.
I mean, it just seems to me it's something where they're more on the ground. They're dealing with the foster families on a daily basis. They're the ones who are more likely to be able to organize themselves to do inspections in a different way, given the opportunity to do so, and their own interest in the foster care program and the fact that they have a high share of cost in that program. So I'm just sort of, I just think before we close this, we should explore some of that. When we get to local government, it's another one of those, multiple choice things. I'm very concerned about these fee increases. Did we just do 10% on all these folks in January?
Well, the governor proposed a 16% fee increase, and I believe the legislature adopted a 10% fee increase.
Right. So now the governor's proposing a 100% fee increase on top of the 10%.
And in part, the fee increases that we proposed in January are a subset of this. In some ways, it's a change of what the fees are for. So initially, we were proposing fee increases for some additional oversight. Now we're looking at those fees in addition to additional fee increases to fund the core activities that we're currently performing.
You're saying to fund the core activities, and then you're getting rid of all the core activities. I mean, people would be self-certifying that they're compliant. I mean, it's not. I mean, if you're going to raise the fees, the least we could get out of it is the child care oversight that Senator Benoit was looking for all those years. And how many of these, this is adult day, meaning like the adult day health care that we were talking about, and the foster family agencies, how many of those folks are nonprofits?
These adult day facilities are not necessarily adult day healthcare centers. These are adult day facilities, residential care facilities for the elderly.
What's an adult day facility that's not an adult day healthcare center?
They have like assisted living.
But day, you said, so that implies to me they're not assisted living.
The residential care facilities we license don't provide medical care, so it's sub-medical care facilities.
Adult day.
Right.
But do we know, are these for-profit or non-profits, or who pays them?
Yeah, that I don't know.
They're not Medi-Cal, they're...
Yeah, don't
The
know.
foster family agencies are nonprofits. And the group homes. Okay. But, so how are these nonprofits supposed to, do 100% fee increases to pay not to be inspected, or whatever it is? I mean, it's sort of, I don't know.
We are retaining the inspection. I mean, the core activities that we're protecting is complaint investigations. We are retaining some random sampling on the adult side. It's the child care side where we are mainly focusing on complaint investigations and follow-up associated with prior findings.
But what's our history of where the complaints are? Isn't daycare, seems to me, and foster care is where... I just don't know how to think about, and I'm real interested in whether the counties might, as part of a larger realignment conversation, be able to be more effective in their oversight of some of these agencies. I don't know which ones or where. Who they do child care too, right? Child care isn't, well, counties do child care too, so.
We contract with them for some, I think they do child care in some counties, right? We contract back with counties for some of the licensing functions based on county interest in doing it. Generally, it's in the foster care side, but I believe that some do the child care stuff.
The number of counties that do child care licensing has been declining over the years. I believe it's down to maybe one or two, and that is probably disappearing. They've basically turned that back to the state. Because they can't do it for the amount of money that we budget to do it at the state level.
And obviously, neither can we.
No.
So
we do the amount that's required with the resources provided.
And really, what we're talking about is the state no longer being in the business of licensing these facilities because it's meaningless. I have Mr. Blumenfield, and then Mr. Dutton, and then Mr. Leno.
I'm open to some of the things Mr. Cheney is saying. We have to do something about the licensing and the inspections. I have personal experience in terms of, as a father of young children, I've recently gone out looking for child care facilities and licensed facilities, and I can tell you there are places that are little better than kennels for kids, and these are places that are licensed, and you go there and they haven't been inspected, or if they have, it's been years. I went to a facility, seemed perfectly fine on the outside, and person's smoking inside near all the kids, and the TV's on, and we only noticed that because we came back about an hour later after, looking at the facility. So we should be doing more inspections and not less. And I don't know how to do that given our budget and how we figure that out with realigning or something else. But to me, I know this situation very personally and just feel very strongly about it. Thank you.
Just one more comment, sorry, Mr. Dutton, and then Mr. Leno, and then Mr. Lowenthal. This is really a business issue. It's an economic development issue. If a parent doesn't have good, quality, reliable childcare, they cannot do their job. And I say that after 20-some years of being a working mother. You cannot concentrate on your work. You cannot be a productive employee if you don't have good quality childcare. And I mean, we're talking about this in the human services area, but it has a much broader implication here to the business community and the economic health of our state. Mr. Dutton?
Yeah, what's our actual total cost? And how much are we charging in fees right now?
The fees range, I believe, currently from $60.
I mean, total for program costs.
Oh, the total budget for the program is $124 million, but we do receive some federal funds. The fee revenue we receive is about $24.7 million currently.
So we got a $124 million cost, and we offset about $24 million of that with fees.
With fees. And then we receive some federal funds.
We mean already. But it costs us $124 to do the program.
$124.
Yeah.
Total.
And we only charge $24.
Yes.
I don't have a real problem with the recommendations. So.
Mr. Leno, then Mr. Lowenthal.
Thank you, Madam Chair. Just to keep in mind, we're talking about 1.5 million clients. So
yes.
We're spreading that far. I think, as you'd mentioned earlier, we're going to be probably leaving this open out of consideration of time. Clearly, we're going to need to take some cut. We're going to want to restore some of the services, especially in the more egregious cases, and there's going to be some fee increase. But I think we need to talk with some of our county folks, figure this out, and then come back.
Mr. Lowenthal.
Yeah, I agree with Senator Leno. Personally, I just want to say this is an opportunity that if I'm going to protect anything fully, it's going to be the slots for child care. It's the direct services rather than the licensing and all the as important as that is, and I agree. So I want to protect, and I'm just going to tell you that. So I think the LAO's proposal leads us in the right direction, maybe too much, and I'd like us to work on that. But I agree, we're going to make cuts here. That's right, because this doesn't take away slots. And that's my primary criteria, because we're going to have to cut, and I'd rather do it as bad as this is. It's less bad than taking away those care slots itself. So I'm willing to keep it open. I'm willing to not go as far, but we're going to have to find some savings.
Okay, I think there's a consensus among the committee members that we do want to go in the direction of the LAO proposal, but not as far, and we don't want to increase fees quite as much because they simply can't be absorbed by the child care providers. And I would again note this is an economic issue, not a human services issue. It's kind of in a weird place in our agenda because of the department that administers it, but certainly, I would welcome ideas and suggestions from the business community as well on this one because they are highly, highly involved. All right, so without objection, we'll move on to page 14, in-home supportive services share of cost buyout for a savings of $41.1 million. Department of Finance, would you like to start us off on this one? This is a tough one.
Sure. This is a January proposal. The February budget essentially implements this proposal prospectively. Historically, there were two different shares of cost for the Medi-Cal program and for the in-home supportive services program. When the in-home supportive services program began receiving federal funds, we instituted this share of cost buyout in part to hold consumers at their in-home supportive services level, but in large part also to be able to access federal funds and to have these consumers go into the Medi-Cal program. We basically paid their Medi-Cal share of cost for this differential in order to be able to access federal funds under what was then the PCSP program. Subsequently, we secured a waiver to be able to get federal funds for most of the IHSS program, and we retained the share of cost buyout, where basically we're paying for the difference between the IHSS. We're paying to meet the share of costs, so that's how much a family has to spend before qualifying for Medi-Cal services, and we pay for it based on Medicaid law, not only for the in-home supportive services consumer, but also for their family unit. This proposal essentially would eliminate that. The February budget eliminated it prospectively. This proposal would essentially eliminate it for the existing caseload, and what it would mean is that consumers receiving in-home supportive services would have to meet their Medi-Cal share of cost prior to receiving subsidized services.
This is the program, though, where if the person receiving the services doesn't pay the share of costs, then that's withheld from the provider's check?
The way in which basically the way that it works is the consumer has to meet the share of costs prior to receiving services. So there's an assumption that the consumer is paying for a certain number of hours and they're meeting their share of cost. The mechanism through which that happens is reimbursement to providers.
Right. So directly, indirectly, but the impact is direct to that provider. They don't get that share of their paycheck that is related to the share of costs that's unpaid.
The consumer, based on how the law works and Medicaid law, the consumer is responsible for meeting a share of cost prior to being able to qualify for a subsidy. So the mechanism, because of what we do, the way in which that share of cost has to be met is that the consumer has to pay the provider for those hours before the subsidy kicks in.
Yeah. LAO, did you have a comment? And then we'll go to members' comments.
Thank you, Madam Chair. Jenny Bella with the Analyst's Office. As Ms. Monasanas mentioned, this is, as part of the February budget package, this program has already been turned off prospectively. So the issue here is really how to deal with the existing or the grandfathered caseload. The administration's proposal proposes to eliminate the buyout program for recipients with functional index scores below 4. The functional index score, I'll just take a second to describe it because it's going to run through some of the other proposals we discussed today. It's actually created when a social worker goes into a home and does an assessment of a potential IHSS recipient, and they give the recipient functional index rankings on various different tasks, and then those rankings are averaged together to create a functional index score. Our proposal, rather than linking functional index ranking or the level of disability to the ability to pay the share of cost buyout, we instead recommend reducing the share of cost buyout by 75% for all IHSS recipients who are currently receiving the share of cost buyout program. This also eliminates any incentive to sort of appeal because everyone would be treated equally under this proposal. I would also note that any reduction taken in the share cost buyout program does not result in any federal fund loss here because it is a state-only program.
Members, I want to note that the next 4 items on our agenda are all related to IHSS, and so, yeah, that's what I'm thinking, that we can talk about them all together. We've got the share of costs, limiting domestic and related services, reduction of state participation in IHSS wages, IHSS Program Integrity Initiative, and the IHSS Public Authority Administration. So if members want to, I mean, we can talk about them all together, and we can hold them open with direction to staff to come back with whatever it is, whatever action it is we decide to make.
Well, yeah. But I think we should hear them all together. I'm prepared to move on a couple of them that I think are a little bit different than the bigger picture questions, but let's talk about them all together and see where we are.
And Madam Chair, I believe a handout was just distributed that I think has all of the issues on it, with the exception of the last one, Senator G. The public authority is not on
it's
this
not
sheet.
On there. So sheet. Madam Chair, maybe the buyout is kind of one thing and the public authority is kind of another, but I do think that goes into the larger picture of what are we going to do in the long run with this program. You want to, Finance, describe the whole?
Yeah.
Why don't you do your whole proposal? If we're going to hear them all together, do your whole proposal at one time.
So, and I'll do our proposal was kind of in stages, but the overall concept is, as the LAO has noted, consumers, we conduct an assessment, it's done by counties, and there's an evaluation of the relative need for services. It's done on a specific service-by-service basis, and then we establish an aggregate score. And what our proposal is basically to focus IHSS services on the neediest consumers, the consumers that we've assessed as being either a 4 or 5, which is the consumers that are at greatest risk for institutionalization based on their aggregate score. Those consumers would continue to receive services. Other consumers would not be receiving services. There's different approaches. Our first proposal was to eliminate domestic and related services, so maintain personal care services for people with a score of 1 and 2, and eliminate domestic and related services. Our second proposal built on that and then said we're going to provide domestic and related services and personal care services to people with a score of 4 and a 5. For people who were a 3, we were going to retain the personal care services. Our final May revision proposal basically protects the services for 4s and 5s, but does not provide services for people assessed at a lower level. We assume that there would be a modest increase in the number of people who would be considered to be a 4 or a 5. So we're looking at another 4% or so consumers being determined with that level of need. In order to be a 4 or a 5, basically a consumer needs assistance with most of their activities of daily living. So that's roughly the proposal. That's on the services side. Our other proposal is to reduce state participation in wages to minimum wage, and we believe that it's a proposal that we are making to again try to protect services to the extent feasible, and we think that this rate, while lower than the current rate, would be sufficient for consumers to be able to retain providers.
LAO?
I'll just start with the second point on the handout, which is talking about the service hour reductions, and the Department of Finance just presented their proposal. I will take a few minutes to present ours, but I will note that yesterday we did learn that the administration does have a concern with our proposal that it may not work with certain Medicaid rules. We are looking into it and exploring it with them, and spending a little more time speaking to our folks on the Medicaid side back at the LAO. Our policy and concept here would be a reduction in services based on the IHSS recipients' need or functional index ranking. So recipients with the higher ranking would have a lower reduction in their services. Here we provided it would be 10% for functional index rankings of 4 or above, 15% for those in the middle, and 20% for the lower functional index ranking clients. This could also be done based on hours, was our thought as well. But this is the piece that we're still trying to work out and figure out if it works with Medicaid. On the next one, on the provider wage reduction, we do concur with the administration's approach here. Given the current recession, we think that we are able to reduce provider wages at this point without impacting the supply of available providers. We will, at the LAO, though, continue to monitor the utilization of the hours and advise you if we're seeing that less hours are being claimed than what we've seen in the past, meaning indicating there could be difficulties securing a provider.
Okay, I have a list of folks wishing to ask questions or make comments. Mr. DeLeon, Mr. Nielsen, and I assume Mr. Cheney. All right, Mr. Nielsen.
Well, it seems like the governor's proposal does go in the direction that we are looking at. You know, this isn't maybe for every budget year prospectively, but it's one very critical time, and we are addressing those with the most significant needs. And I think that was your goal. I can understand the LAO proposal in a proportional reduction in hours at a different percentage reduction based on the class, but I would more lean towards the governor's proposal on this particular point. The individuals who are so ranked, do they not also still have an ability to appeal that ranking?
They do.
One time or several times?
They have. There's an appeal process, and they can appeal the determinations whenever they're made.
Okay, and so if I guess my point would be that if there are some conditions, extant condition that deteriorates, that they require that higher level of care, they can be placed in in the higher level of care.
They can reapply for the program, and they could also appeal the determination made by the social worker through an administrative hearing process.
Okay. Let me be clear in terms of the position of LAO and the governor on the anti-fraud initiative. Is there any, can you reconcile your points of view on that one?
We think there's been a lot of concerns about program integrity and fraud in this in the IHSS program. Some of the concerns or issues that have been raised have been investigations about the extent to which hours are being paid for that have not been delivered, the extent to which multiple providers submitting timesheets for more hours than services that can be provided, and we have an anti-fraud and program integrity initiative to address some of those concerns.
Well, what's the difference between a work group and your initiative? I mean, a work group would imply a designated number of redirected staff for such purpose, I assume. How does that differ from your initiative?
Just to clarify on that, the administration does have a proposal before you that addresses fraud and program oversight and accountability in the IHSS program. And we think that there are a lot of components of the administration's proposal that have merit. And in fact, some of them we have made some recommendations in the past that are very similar to some of the things that are being considered by the administration or proposed by the administration. Our concern here is that there's a lot of policy being made and there's a lot of different entities being affected under the administration's proposal, including 30 bodies being added at the Department of Health Care Services, 30 positions, and 12 state-level positions also at the Department of Social Services, and then also some different requirements being placed on the counties. So there's a lot of different entities working together, and to get that coordination right is the key here. Also, we just want to make sure to note that the costs here are certain. The amount of investment that we'd have to put into to supply these positions and also to enforce some of these new rules are certain. Those will definitely happen. The question is really about the amount of fraud that we'll actually be able to find and to collect. The administration's proposal assumes a 2% reduction in service hours, and whether or not that's actually achievable is our concern at this time. We do acknowledge that fraud is a concern in this program and that there are parts of this proposal that have merit, but at this point in time we think it's moving a little too fast and instead recommend enacting trailer bill language to establish a work group or a task where staff can get together and really talk about what's the right way to approach fraud in this program to ensure that we can have an impact here.
My experience is work groups tend to wallow around and waste an awful lot of time and not come to conclusions, but that begs the issue. I would be more inclined towards the governor's proposal, finance proposal in this particular area. I think as long as the threes and twos have an opportunity to appeal their class plus, it would seem that we would be serving the most needy.
Okay, Mr. De Leon, then Mr. Cheney, then Mr. Blumenfield.
Thank you, Madam Chair. I'd like to touch upon the 30 positions with regards to the integrity of the program and the allegations of fraud. If you, in fact, take the Department of Finance's proposals with regards to share of costs, limiting domestic and related services, and also the cost containment issues, if you take those three components, you in effect are gutting, you're eliminating, you are eviscerating, decimating 90% of the IHSS program. Again, share of cost, the domestic related services, as well as cost containment. Those three components put together are 90% of the whole program. You decimate it completely. And to put a face on this issue, we're talking about, and I think there was an article that came out yesterday in the San Francisco Chronicle, somewhere, I don't know where it came in, in the paper, a 80-year-old woman, 80-year-old woman who takes care of her 73-year-old brother who has polio. And what you have in effect is you have parents taking care of their disabled adult children or disabled children. You have, families who are assisting family members, their loved ones. And in effect, you have people doing God's work, and you're gutting and eviscerating 90% of the program. So the whole issue with regards to fraud and the addition of 30 positions, to me, it sounds fraudulent on the face of it. And I don't know what's going on there. with the interesting bookkeeping. But I will say this, is that when we talk about the functional index, with the functional index, you're removing, if you take 3.0 of the functional index, you're removing approximately about 320,000 folks completely. And if you take the functional index of 4.0, if you score them, whatever that methodology is being utilized, you remove 155,000 people from the 4.0 FI index. I got a perplexed look and I got a head going up and down right here at the table. So the thing is, and I want to share this because the functional index is very subjective. It's arbitrary. How it's going to be applied is unbeknownst to me as well as all my colleagues here. If you take, for example, and this is an actual case. These are actual two cases. A 30-year-old woman with cerebral palsy, developmentally delayed, completely bedbound, and fed through a tube, has a functional index score of 3.6. She would be knocked off the roll. If you have a 7-year-old child, with birth-related disabilities who requires a G-tube for feeding and medication and ongoing wound care surrounding the tube site, that person or that child gets a 1 for housework, laundry, shopping, and bathing, and because of the age, a 3 in mobility. And then when you add, and a 4 in other 2 areas, when you add it all together, this child who's 7 years old gets a functional index score of 1.9. So that 7-year-old child, or I should say, yeah, that 7-year-old child is knocked off too. So we talk about the functional index and the methodology and how we crunch these numbers. It's beyond belief that we would eviscerate 90% of this program, because this is what you're doing in effect to a 7-year-old child, to a 3-year-old child, to an adult who's disabled and can't fend for him or herself. And I believe that in a good society, we protect those who cannot protect themselves. In a good society, we defend those who cannot defend themselves. And this is a case in point, in my humble opinion, is we have to fend for the most vulnerable. That being said, ironically, I find this proposal also to be not just morally bankrupt, but just fiscally completely irresponsible, because with the decimation of the 90% of these folks who we're talking about, in effect, what you're also doing is you're taking 340,000 healthcare workers, and now they're effectively unemployed. So if our current unemployment rate, according to EDD in the state of California right now, is 10.9%, if it's 10.9%, we would take it with 340,000 people off payroll to 12.9% unemployment rate in the state of California. So I find the proposal policy-wise morally bankrupt. Fiscally, I find it irresponsible and fiscally imprudent that we would do such a thing. And again, it is just beyond belief because, again, these are the poorest of the poor who can't fend for themselves. We can say, well, we can have nursing homes take care of them. We have 12,000 beds that are available in the state of California, only 12,000. So the numbers don't work. So where do they go? Do they end up in the street or they die? And as my colleague Bob Blumenfield articulated yesterday so eloquently, this accelerates life expectancy. In other words, in short, they die. And that's how we save the money. Their life deteriorates quite rapidly. And this is beyond me. I got a couple questions, is the Medi-Cal formula is 50-50. With the IHS formula, the state covers, if I'm correct, 25%, 35%, 15% county, and the others 50% Fed. Now, does that take into account the enhanced FMAP formula?
No, not yet. So the enhanced FMAP would be closer to 62% of the total program cost would be federal, and then whatever's left over would be 65% state, 35% counties.
65% state?
whatever's after the feds pay the 62% of total, you have 38% left over. Then the states then pay 65% of what's left over, and the counties pay 35% of what's left over.
With the enhancements of the FMAP, how much do we leave on the table with the feds, with the proposals to gut and eliminate virtually the whole IHSS program?
I think just the cost containment piece, I'm estimating that it's around $1.4 billion is the total lost federal funds, but finance may have a better number for you.
Please. So actually, yeah, it's $1.4 billion we leave on the table.
For the issues on page 15 of your agenda.
Just on containment.
Sort of the big containment one, right? There's none on the share of cost buyout program. You wouldn't lose any federal funds there because that's a state-only program.
Does Department of Finance have anything to say? No comment?
Oh,
I'm sorry, Department of Finance?
I think that's generally in the ballpark.
The ballpark figure? Okay. Any way how we justify this, folks? And feel free.
I think this is a really difficult reduction. The administration is not proposing this lightly. Our general fund condition is such that there are difficult reductions that we think are required, and this is one of those such reductions that we believe is required. We are protecting services for the neediest consumers based on the assessment. The assessment process has been substantially improved through the Quality Assurance Initiative that was enacted in, I believe, 3-4. And our general fund condition is such that we cannot continue to provide the same level of services that we have been providing in the past. This is the IHSS program is an outlier in terms of national benefits, and it's a program that we think we need to make some substantial reductions in, just based on the fact that it's not federally required. It is an option. It's a reduction that we can make without incurring federal penalties that result in substantial general fund costs.
You know, I'll say this, you know, with regards to an outlier, and other states in the nation haven't followed our lead. This is a cutting-edge program, in my estimation, because it does contain costs, because these folks don't have to be housed in a nursing home. I do understand quite clearly the whole issue with regards to the cost pressures of the general fund, and given the financial circumstances. I guess what I'm asking is LAO, DOF, everyone involved, staff, Democrats, Republicans, somehow, some way become much more creative, because again, when you add the share of costs as well as the cost containments and the limiting domestic related services, it's 90% of the whole budget for this program. And again, just to use, and I'll finish off right here, Madam Chair, this 7-year-old child who's fed through a G-tube, according to the methodology in the functional index score, that person's on the street.
Thank you, Mr. DeLeon. Mr. Blumenfield, then Mr. Nilo, then Mr. Leno.
Well, certainly want to echo what Mr. De Leon said and agree with it tremendously. I also want to point out, so we're talking about the state, 65% of 38%. So the state is paying 24.7%. You know, of already a very, very cost-effective program, and we've talked about that. I wanted to address a little bit about the issue that you mentioned. About both the Department of Finance and LAO were saying that the lower wages can happen without hurting services, and I just don't believe that. I mean, I think that the lower wages, that may be true in an economic model where you have an infinite labor pool, but in this situation, I mean, what we're talking about is most of the folks who are working, a lot of times they're family members, and they're not open to an infinite labor pool for them. When you look at the wage, you're talking about a family member who's probably, you know, they're going to, or a relative, they're going to put in a certain number of hours. They're only billing for a certain number of hours. The amount of work that they're actually doing is a lot more than that. So we're getting a tremendous deal on the program. It's one of the reasons why it's been so cost effective. But the flip side of that is, you know, and I know a lot of these folks, if they're in the district, and I'm sure we all do, when you increase that cost, and if you bring them to the breaking point, their next step is not to go out and, and then that family member says, we can't survive as a family anymore. I'm going to go out and get a different job and do this and that. They're not going to just bring in another in-home worker. They're going to shift this person to a nursing home. And so it's one of those things that's been proven time and time again as a cost-effective program. I think we have to be really, really careful about it and look at the real cost shifts that are involved. And I just don't believe that lowered wages are not going to hurt services when you really look at the way this program works.
Mr. Nilo, then Mr. Leno.
This particular program is one that has been growing over the past decade far faster than virtually all other programs, and certainly faster than the underlying cost of living. And I think it makes good sense in the best of times to look for ways to try to control that growth and yet still stay true to the goals of the program. Now, these proposals go farther, certainly because of the severe stress to the general fund. When you don't have money, you can't spend money. So it's a kind of a triage approach to serve the most needy, and it does make good sense to me. There can be ratings, anecdotal examples of ratings, 1, 2, 3, 4, 5, that might be inappropriate. But as was pointed out in Mr. Nielsen's question, that can be appealed. And we had some anecdotal exceptions. I have no means to challenge those one way or the other. They just sit out there as offered evidence, unchallenged. I just suggested maybe one or both of those could be challenged in what the rating was and end up with a different rating. Specifically, I have a question about the item 307, the fraud detection, and we're estimating a cost savings there of roughly $33 million. Is that taking into account a substantially smaller number of clients in the program? And to the extent that there is fraud, is it more inclined to be in the categories 1 through 3 or 4 and 5? And so perhaps, is this number maybe a bit exaggerated?
I think this number would need to be adjusted based on the rest of the actions. If you wouldn't get this level of savings with the level of program that we've proposed.
And similarly, you wouldn't need the required level of resources either. The 30 positions would be.
Okay, good. So this proposal is applicable to the existing program. It does not assume adoption of the immediate 4 proposals.
Correct.
Okay. You have any idea what the number?
Mr. Nilo, pardon, which one? Yeah, we didn't quite follow what you just said.
This proposal on page 17 projects a savings based upon hiring additional people to discover and prevent fraud. However, the number of positions required and the savings projected is based upon the existing program level. If we adopt the previous recommendations, and I'm not suggesting that we're going to do that, although I support them, but if we did, the number of positions that were hired and the resultant net savings would be, I think, substantially less.
That's correct.
Be 90% less.
Yeah.
Well,
not maybe cutting 90%.
Maybe even more than that, because of the fact that, as I was asking the question, is to the extent that we're aware of fraud, is it more prevalent in the categories 1 through 3 than it is 4 and 5? And I saw some nods out there. I didn't get a straight answer, but that it may be even disproportionately less.
All right, we're going to go to Mr. Leno and then to Mr. Cheney, who will hopefully have some suggestions and move us towards a consensus that we can give direction to staff on. Mr. Leno? Then we'll go to Mr. Dutton after Mr. Leno.
Thank you, Madam Chair. Ms. Matasanos, I don't think anyone on the panel doubts the difficulty of your job as being not much different from ours, having to find some significant savings in areas that are difficult to consider on many, many different levels. But I think we are looking for some thoughtful and rational conception behind the proposals. So with regard to your service hour reductions and relative to the FI scores, that has nothing to do with eligibility to pay. So what's your thought behind that? Why would we not want to have some eligibility, some consideration with regard to ability to pay?
So, I think part of the complication, and this relates to the issue for some of the alternatives that that LEO mentioned. One is IHSS consumers are are enrolled in SSI and they're enrolled in Medi-Cal. Because we're getting Medicaid funds to fund the program, then there's a lot of requirements that are related to Medicaid law relative to, for example, the level of cost sharing that can be applied to people at different levels in the income scale that in turn apply to the IHSS program. There's other requirements that are the ones that are at issue in the LAO alternative that has to do with the fact that if based on the criteria, IHSS is essentially an optional benefit under Medicaid for the bulk of the services. Based on federal law, once you provide an optional benefit, if we make an assessment about what is medically necessary, then generally the approval of services has to be consistent with medical necessity. So in terms of different options and approaches, they're in part constrained based on the funding streams and the requirements that go along with those funding streams. And Medicaid has very specific rules about what level of cost sharing is allowed. And generally, for people who are below 100%, the allowed level of cost sharing is very small.
With regard to the functional index, correct me, it was created for the purpose of uniformity of the program?
It's the functional index is part of the assessment process, and it was created as part of the assessment and for uniform application. There were some changes done in 3.4 to try to ensure that assessments done across counties were being done consistently, that improved the process and improved the use of the functional index and the functional scores and ranks and all the different pieces that go into effect in the assessment.
Would you say we've used it for purposes of eligibility before?
In some ways, the way in which eligibility works in IHSS is linked to the assessed level of need. So if I go through the assessment, if the social worker does not determine that I need assistance with a particular service, then I'm not eligible. So they're kind of tied. So functional index is part of the eligibility determination process, which is in turn linked to the assessment about the level of services that an individual requires. Historically, though, the functional index is related to whether or not somebody gets a particular service. The use in the way in which we're proposing it, this is generally a change because we're looking at using the assessment that we currently have in effect to then prioritize and provide services to the neediest, to the consumers that we've determined are the neediest.
I hear all of that, but then with regard to the examples that Mr. De Leon pointed out, doesn't seem very rational. And I understand that the reason those very extreme examples appear is due to the fact that paramedical services aren't a component in the determination of the functional index. Is that accurate or close to accurate?
Yeah, paramedical is a separate. The way that it works is you get a particular score based on the particular services, and then those ranks are then aggregated to determine the score. So, for example, if I am a person with Alzheimer's, where I have my ability to shower, to do meal prep, to do a variety of activities, if I have somebody helping me. In terms of reminding me, if I can do those by myself, then I have a low score in those areas, but then in the areas that relate to need for cognitive assistance, I would have a high functional index rank. When you look at those aggregate scores, then that has the effect of, some depending on how many things I am assessed as needing assistance with, that affects my score. Does that make sense?
I won't say it's tortured, but it's difficult to implement that into the real world. There are going to be people falling through the cracks. I think some of the examples we've heard are evidence of that. And so it just seems that to eliminate entirely all services for those with scores under 4, and that's what the proposal is overly severe and not quite surgical in its effect.
I think we're looking at, with our general fund resources, how to prioritize it on the people that, through the program, we've determined have the greatest level of need. And there are some consumers, many consumers, that we've determined could use a certain level of services that would no longer qualify. It's a function of our general fund condition and relying on the program structure to determine who are the neediest consumers.
And with regard to the couple of examples that Mr. De Leon brought forward, do you challenge that information?
I can't speak to the specific cases. I'd have to look at them. I don't have the particular situations for those consumers and where they rank. I don't challenge it. I can't speak to it. So
okay.
I don't have it.
And with regard to the situation reported in the Chronicle, to which was referred, took the case of an 82-year-old woman who was very fearful that she's going to be losing her IHSS support, but not for her own caregiving. She is the caregiver not only for her 72-year-old seriously disabled brother, but her 100-year-old mother. She is the caregiver.
Yeah.
So I just lay all this out because I think we need to proceed with caution. I think that there's a little more wisdom in the LAO proposal than in the administration's. And then, given that we are talking about these as a package, I just also want to weigh in support of Mr. De Leon's concern with the reduction to minimum wage. And that, again, I think that's more of a sledgehammer approach, given that we have counties that have much higher costs of living. So clearly, those counties are going to have to pick up that difference. In San Francisco in particular, we don't have minimum wage, we have livable wage, so we're going to have to make up that difference. We have always made up the difference even prior to the recent reductions. And this is, again, yet another, and we've found any number of them in recent days, cost shifts to the counties. It's just as simple as that. And we have to be aware of that if we're going to do it.
I completely agree. It's a cost shift to many, many counties. Mr. Dutton and then Mr. Cheney to hopefully throw out some ideas about where we might go from here. Mr. Dutton.
Yeah, obviously, that's the reason I was kind of passionate about eliminating the underfunded and unfunded mandates that we were discussing yesterday, but because I am concerned about cost shift to counties. Nobody likes having to go down this path, and I wish we had a robust economy, and I've probably argued as much as anybody about some of the heavy-handed regulatory requirements we put on businesses and everything here in this state. And it's unfortunately, this is one of the prices you're going to end up paying if you're not going to allow a robust economy that helps grow the jobs in the private sector. Then you're going to have to provide less services, and I don't like this any more than anybody else. Let me ask you a question, though, about in-home supportive services. How many other states provide this type of program? Are we unique?
The program California has is unique. There are some other states that provide some IHSS services, but not to the extent that California does.
How many of them pay family members to be caregivers?
That I don't know. That I don't know.
States. Are we one of the only ones that do that?
Some other states use a cash and counseling model, which allows essentially as a way of getting the family members potentially involved.
But would you say we're we're actually one of the few, though. I mean, there's not a lot of states doing
Yeah,
it.
you either need some sort of a waiver. We got the Independence Plus waiver. Some other states pursued the cash and counseling model. So it is something that the initial federal system does not allow. You need to get a waiver to be able to do it. So it's the minority of states, I believe.
Recently, I think,
responsible relatives. Yeah, the feds will always participate for essentially. For relatives, for say an adult child caring for an adult parent. What the feds always had a restriction on was the responsible relative, meaning a spouse caring for a spouse, or essentially an adult caring for their minor child, the parent caring for the minor child.
All right. Recently, there's been some work done by the grand juries of Los Angeles and Sacramento counties. Are you familiar with their investigations and reports? It seems unfortunate because what ends up happening here, this was a well-intended program, obviously, but because it's got so much fraud and abuse and so forth in the system, those that really need it the most are end up going to be paying the price. So it's not necessarily the legislature that's doing it or even the governor. It's frankly some of the real responsible people out there in our society have caused a problem. Is there anything that's proposed here to actually put some stiffer penalties, like having people, when they furnish personal financial information and medical information, about them signing on their penalty of perjury? Is there going to be, I mean, what are we doing to even take the remaining people that are going to be in this program? How do we fix it so we can definitely form a real deterrent towards the abuse and the fraud?
We are proposing a variety of changes. Some include, for example, criminal background checks for non-relative providers. We also have some efforts to make sure that we're doing more spot reviews of submitted timesheets to ensure that we're paying for services that were in fact delivered. There's also new requirements to ensure that that timesheets are submitted under penalty of perjury. So we have a variety of changes. Also, currently, there's only two positions at the Department of Healthcare Services to handle fraud for what's close to 500,000 consumers. So part of what we're looking at is changing that ratio some and increasing the level of resources so that we have more active audits and investigation presence to follow up on concerns about fraud.
And that would be including making sure that we aren't paying inmates that are currently incarcerated for caring for relatives and things like that, I'm assuming, and we also want to make sure they're living as well, right?
We want to make sure that...
Which we've had cases where we've been paying people that for some weird situations.
There are cases where services are not delivered, the situations where the provider is not able to provide services. There are situations where providers are being paid for more hours than probably can be delivered. There's a number of different program integrity issues and fraud concerns that have been raised, and that's why we think that our fraud prevention initiative is an important component of the proposal.
Well, reluctantly, I would support the governor's proposal on all these issues, but I do understand that Senator DeCheney may have some alternatives, but I'm going to be supporting the governor's recommendations.
Mr. Cheney.
I mean, the discussion's useful, members, and I guess my concerns, I have two or three thoughts as staff goes off to try to figure out what to do here. I mean, I think there's a general sense. I think we all know this program has grown sort of in exponential fashion that's a little confusing. Some of it is demographic. Baby boomers get old, right? More people are eligible. But I know, at least in some of the smaller counties, it's just been sort of, it's so huge, and whether it's a combination of both the demographics of aging and the income, but for some reason the caseload in this thing has just been sort of exponential and explosive over the last few years. I mean, when we did the functional index thing, it was designed to be, in a way, a cost containment standardization, as Finance said, a way of trying to rein this in, because it seemed so chaotic, sort of, because every county was different, and how do you do it? And so that's what that was invented for, was to try to standardize the number of hours. So we didn't have quite as much. I mean, in fact, to try to get to some of the issues that lead to this defraud accusations was, okay, let's standardize how many hours you get for doing this throughout the state. And I think that county eligibility workers, and those are real county employees who do that analysis, right? Who decide if you're eligible and who go into your house and decide how many hours of service you are entitled to. So, but the thing has just grown so crazy, it's costing both us and the county. So this one is huge in directions for both of us. Let me ask a couple questions. One is, this is an optional Medi-Cal benefit. Once you're entitled to the benefit, though, are we stuck with a sort of an entitlement deal?
The personal care services component is an optional benefit. Other services we're providing under a waiver. So it's the personal care services that is the optional benefit, but in effect, the whole program is an optional benefit.
Yeah, in some ways. Okay, but once it's a benefit of that nature, then does it become an individual entitlement? I mean, actually, one of my more radical ideas was thinking about this as a block grant program in some fashion and saying, you know, whatever money's there is whatever money's there, and then trying to think about how to prioritize the needs. Regional center referrals, doctor referrals, get higher priority, rather than using the functional index thing, which that's not what it was designed for. Thinking about whether, I don't know, it's my community college self. You know, when you have to say who gets in, and you got to prioritize, you say the high school students that graduated in my neighborhood get in first, and the folks who need to transfer get in second, and the folks who need career get in third, and the folks that need Senator Dutton's basketball evening classes get in fourth. You know, I mean, it's sort of a how do you prioritize the client role, but having that done more through a clear process that's like the regional center referred you because you're entitled to the service. The 3632 referred you because in order to be able to go to school you need X care at home. I mean, I don't know how to think about those, whether that's even legally possible.
And it depends a little bit. But with the Medicaid funding streams, there are kind of three kind of key rules that come into play. Okay. One is statewide-ness. And generally, absent a waiver, it has to be rules have to be the same across the board.
Okay,
the second is similarly, it's the comparability rules, and it basically means that similarly situated people can't be treated differently. So if I live with my parents, but Nick doesn't live with his parents, if Nick and I are in the same position and Nick is getting domestic services, then I also must be able to get domestic services.
Really?
I can't be treated differently based on my living situation if we're in the same comparable category. So
really?
Comparability.
So I can't say to you that. Well, yeah, but when they do the functionality, they say because somebody's living with you, you don't need additional assistance with food preparation, right? Can't they do that at least?
Yes, those kinds of things are considered.
I mean, there should be some accommodation to, I live alone. It goes back to my priority thing. If you're alone, then your need for services, in my view, would be different than your need if somebody lives with you. Because the domestic services in particular, if you have somebody living in your household, they should be cleaning the house anyway. Why they have to clean the house for you and get paid for it is sort of...
Based on the current rules, you have to authorize for the portion of the house that you occupy.
Right.
So if I'm one of four, and if I live with my parents, it's you have to pay for the one of four. You can't, and you have to treat me the same way as somebody else.
Even if he lives alone?
If he lives alone, then you pay for 100% of the house. It's based
I understand,
on the
but
number of
I actually find a rationale for that. Why I have to pay somebody to do your 1/4 of the house is a little bit...
That's the restrictive federal environment that Ms. Montesanos has been talking about, that
complicates our life. Okay, limits our options. Okay, next.
Here.
What's our other limit? You said 3.
The third basic rule is the criteria generally has to go with medical necessity. So if the assessment determines, if you say, for example, we're going to provide this service and we're going to provide this service based on X, Y, and Z conditions, and it's easier with dental, for example. So if you think about in dental, if I'm eligible for 5 fillings a year, then if somebody determines that I need a filling, as long as I haven't gotten, as I'm in the position where I'm on my 4th filling, then I get it. The criteria is you establish the criteria for how the service is provided. If you say that we provide right now, for example, it's up to 283 hours. So there's a cap for the level of services that we provide. The cap can be applied, but you can't determine that I need 20%, 200 hours of service, and then say, well, you're only going to pay for 180. The criteria has to be based on medical necessity, and it has to be based on the assessment.
But I can cap it.
You can cap it. You
Okay,
can
so
establish.
capping
You can
is a-
establish. Yeah, we can establish caps. We'd have to submit a state plan amendment, work with the federal government for authority, and you have
the
to
cap
make it
would
clear
require
that
a state
there are-
plan amendment?
Well, we'd have to work with the federal government. Currently, the caps are in the state plan.
And the cap we have now is?
It's 283 for severely impaired, and it's 195 for non-severely impaired. And the definition of severely impaired is whether or not you need more than 20 hours of personal care services.
A week or a month? 20 hours meaning?
So if you need more than 20 hours of personal care services, then you're determined to be severely impaired, which applies a cap of 283 hours per month.
20 hours per week.
So in theory, yeah, 20 hours per week. Okay.
20 hours per week triggers 283 hours per month of cap.
That's bizarre.
There would also be an option to potentially look at currently to qualify for any service in IHSS, you have to at least have a functional index ranking of a 1 for that particular task. So there might be some room to look in thinking about establishing different floors for certain tasks. So you have to reach a certain level of disability before you are eligible for that task.
Again, in the complicated environment, that creates enormous incentive to sort of then appeal. If you're just below what
Because
that
of the
whatever
entitlement
floor
thing. Yeah,
the
that's why I don't
legislature
want to
might
mess with
set.
that as an eligibility
Yeah.
thing. Okay. The other, as you all go forward and try to figure out the eternal answer, here's our shot at trying to fix this program. We should be talking to counties and everybody else as staff goes off on this one. But I'm back to the part we talked about yesterday a little bit. The MSSP, Adult Day, and this all kind of got to go in one thing. I don't know what that looks like, but at least those three, there may be more that need to be in that mix because they're all related. They're all based on the same thing. And the other piece that sort of plays in here, and I don't even know how, is the regional centers. I mean, when I was thinking about priority questions, to me, the person who is referred to the service by the regional center probably has priority because they're probably entitled to the service under some law someplace, and therefore are the folks that first order of business kind of. And I don't know how to think about some of those, the referrals from doctors, referrals from them, whether, because I guess my third point, which is this fraud problem that apparently exists both in Adult Day and in this one, rather than just hiring people to go, 30 people to go wandering around the state looking for the, I don't know, that doesn't seem to be very effective. It would be better to design the program so it was less prone to the ability for people to use it inappropriately. And so it seems to me if we standardize, professionalize, something's got to give in terms of how we approach that and within all three. In other words, if you got to have a social worker someplace that refers people, and you got to have somebody who do these social workers who go in their house and figure out the hours, do they go back, random visits, we're back to child care. See, maybe there ought to be, I mean, we talk about it in CalWORK, self-sufficiency. Maybe folks need to be kind of checked up every 6 months to find out, is the person really showing up? And, you know, are you really getting the hours? And I don't know.
They do have a current reassessment process that happens usually every 12 months, but there are exceptions up to 18 months. So we do go, the
So
social
there's a
workers do go in and
reassessment.
reassess and have conversations with the recipient.
The recipient can also request a reassessment at any point in time. So there's as the LAO noted, there's the standard
But that
process
forces somebody to go in the household and find out if the person you're paying to be there is actually showing up once in a while or something. Because I don't know that we have enough monitoring over that. The sense of the hours, especially because they're family members. Oh, gosh, gee, Grandma just signed the time card. You know, whether you were really there 10 hours or 15 hours, Grandma's not going to count that. I mean, I don't know how to account for that. I'm not saying everybody does it, but that's obviously where these fraud issues are coming from. And so what do we do to control that?
I guess we would point out that essentially this is really not a case management model. The social workers make an assessment, and then authorized hours are essentially granted, and we're going to check in on that every year and a half, unless the client asks for a more frequent check. So you know, essentially enormous discretion. Some would argue empowerment to the clients to choose how their care is going to be administered. But essentially the program from an administrative standpoint, it's minimal. Our
But that's
contact with the
causing us
client is
not-
minimal. So that sort of creates a situation where the work rules are having to be enforced
It's all
by the recipients,
yeah, no,
who
it's-
in many cases are infirm or even developmentally disabled.
So
It's
yeah,
the model
that's
we've
the
chosen.
problem. Well, we're,
you know,
well,
I mean, it's the model we have.
Right, I got it. So that goes to the fourth item here, and just go back to the first item, just so everybody knows. I'm pretty open to increasing the share of cost. I mean, I think the 100%, we're beyond that at this point. I'd be open to 50%. I'm not interested in zero, but I don't know what I just sort of sharing the cost of the share of cost, as it were, with the recipient seems to me not unreasonable in this case. But on the bigger one is the public authorities, and whether it's on here as an issue, just because of the cost of the administration that way. But I mean, I have two big questions in that arena. One is, could we have fewer than 56? 20? We only have 21 regional centers. If you divided the state into logical regions, maybe it's 10. LA gets its own, and after that, I don't know whether to think whether there would be a consolidation of the administrative costs that would allow us to have money to pay for the services that would help at all. I mean, and that may be a longer term sort of thinking about this, but the flip side of that is also, could they then be more consistent and require everybody to be registered and not have everybody just, I just picked my brother down the block who happens to be unemployed to be my care worker, rather than having a list of folks who've been fingerprinted, that we can send you 2 or 3, and if your brother down the street wants to be a care worker, they should sign up. I don't know how to think about how to change that system, and those are the 2 or 3 places it seemed to me. The other one would be capping the hours differently, changing the hourly caps. I'm not real excited about lowering the wages again after the one we just did, because I think it's lower than most folks can live on anyway. So, but I'm interested in capping hours, capping ability to use services. I don't know that, creating different ways for folks to be referred or not. If you're in MSP, do you get adult day and IHSS both? I mean, I don't know how to think about that.
One of the issues with capping the hours that we looked at before is when you set different caps based on, say you were going to set a different cap for recipients who had functional index rankings between 3 and 4, and you were going to set a cap level for the total amount of hours they might be eligible for. The problem with it is the cap is only going to impact those people at the higher end of that range, because everyone else is below the cap already. So the real savings is coming from sort of the higher need people that are above the cap anyway.
All right. I'm going to, Mr. Blumenfield has a question, and then I'm going to try to wrap up this item, and we'll move on.
Although just a little bit of a response. I actually like the idea that you're hiring your unemployed brother down the street, because most of the time, if it's that situation, it's a family member is going to be the one who's going to put in more time and more effort and give you a better bang for your buck, generally speaking. But I want to tease out a little bit about, we touched on it a couple times, the cost of nursing home versus the cost of in-home services. And how do we rank as a state compared in terms of nursing home capacity to states that don't offer in-home services? Does anybody?
We'd have to check with our Medi-Cal folks back at the LAO to see if that information is even available.
Right. Because I suspect, and I've heard anecdotally that we keep a lot of people out of nursing homes because of this program, and generally speaking, I assume that you recognize it as a program that has saved costs. Is that correct across the board?
I think it's difficult. I think one of the things we recognize about the in-home supportive services program is that it does serve a very diverse caseload. There are some people that are very high need at the high end, over 200 hours. And there's other people that are lower need that aren't receiving a lot of hours of service every month. There's also really some people that are at the higher age limit. They're over 80 years old, but there's some children or young people that are getting services from their parents. So in terms of determining cost effectiveness here, it's really to look at the entire program, and it's difficult to predict who would actually enter a skilled nursing facility in the absence of the program. And the key to most of the governor's proposals here is to really target services to those who would be most likely to enter a nursing home in the absence of IHSS, and therefore preserving most of the cost effectiveness of the program.
Therein lies the challenge, because these are the most disabled folks that need the most services. And I think one of the things we really have to recognize is the reason the caseloads are increasing so rapidly is our population is aging. That is just an indisputable fact. And it's not that they're increasing in a vacuum. We have more disabled folks and we have more elderly folks. And so there's just more need. And I think that's why you see us all struggling, and we're all struggling with this, because the need is there, and as a state we have taken on the responsibility to fulfill that need, and how do we continue doing that under these circumstances? So I think, I don't know if you've got enough direction. I feel like, we're trying to solve a huge policy issue and a huge societal issue here in, a discussion of 45 minutes, and it's clearly not adequate. But in addition to some of the things that Ms. Ducheney said, and perhaps repeating some of them, I would just try to synthesize what some of the comments were. We want to avoid a 90% reduction in caseload. That is just not acceptable with the population that we have here in the state of California. The functional index appears to be very inappropriate for the use of determining eligibility. I don't know if there's another one. It sounds like there isn't, but that is highly problematic. And that maybe there's some way in which we can use that makes sense. But overall, as a standard, it's highly problematic. You heard the idea of block grants to counties. That may be an elegantly simple solution, but I don't know what other problems it causes.
Federal funding, I think, would be the issue there.
Medi-Cal.
We'd probably need a new waiver. That's the cash and counseling model, potentially. Right. So, again, immediate savings.
That's why
takes time to negotiate that waiver.
It's a long, I get it.
That's why I said it may
long and
appear,
short-term goals here.
That's why I said it may appear elegantly simple, but elegantly simple solutions don't always work. Capping hours is, again, another problematic solution, but something to certainly look at. And then, personally, I would accept a substantial reduction to the Public Authorities Administration. So hopefully that will give you enough direction to come back and craft a proposal that we can adopt on Monday. With that, we'll move on to page 19. Reduction of supplemental security income and state supplementary payment grants to the federal minimum for a savings of $245.1 million. And my understanding is that on Friday, the governor made a new proposal that I had not heard of to also take away state COLAs going forward for now until forever in both CalWORKS and SSI. So I would appreciate the committee being educated on that new proposal to start with, and then we can go on into the rest of it.
Sure. So the proposal, as you've noted, is to reduce SSI-SSP grants to the federal maintenance of effort minimum. We also are proposing, as part of addressing the out-year budgetary gap and as one of the different items of reform to address our structural deficit, to eliminate the automatic cost of living adjustment provided to the state portion of the grant prospectively. The legislature and the governor could always choose to provide one on a case-by-case basis based on the general fund condition, but we think that the COLAs, as an automatic COLA, ought to be eliminated prospectively. It's an out-year savings issue, as the COLAs have essentially been suspended for the budget year based on the February package.
LAO?
On the broader issue of long-term COLAs, I think the LAO approach has been, we don't like autopilot spending. We think the legislature and the governor should come to decisions about COLAs, but you wouldn't want to just isolate that decision just here in SSI, SSP, and CalWORKS where we have COLAs. It would be kind of a broader look at all the places in the budget, and I'm not obviously our 98 expert, but various places where certain kinds of automatic increases are in place. You'd want to turn them kind of all off and let them be a budgetary decision for the legislature and the governor each year on that.
And we concur with the LAO, and that's the reason why we're proposing the COLAs here. We're looking at across the board, looking at eliminating those COLAs and growth factors in a variety of different places, including judiciary and other places where adjustments are provided on a statutory autopilot basis.
But my understanding is the governor's proposal is to do that prospectively forever, not at any given budget year.
Correct. We'd eliminate the automatic adjustments,
Right.
and then on an annual basis, based on the level of resources, the legislature and the governor could decide whether a COLA was affordable, and it'd be an annual decision versus the current automatic increases built into law.
Which has de facto become an annual decision anyway, because we always look at the COLAs. Always. At least every year since I've been here, we've looked at them and we've suspended them. Okay. Ms. Ducheney?
Just one question. Seems to me, when we started SSP, which I don't have any idea what year it was the idea of this is mostly that we're bought out food stamps and stuff, right? I mean, somebody go back to the SSP question and the food stamp interaction, because most of these folks, now that we've reduced the grants, even under the current thing, before we take the governor's next round proposed here and may revise of cuts, these folks are below 100% of poverty. At least the single ones are. At below 100% of poverty, aren't they eligible for food stamps and Medi-Cal?
SSI was started in the 1970s. I think the food stamps buyout occurred at a later point in time, and at that point in time, it was done basically at a $10 food stamps buyout, and individuals became ineligible for food stamps. There are varying impacts. The issue of whether or not to undo that change has been looked at over time, and there are different impacts on different components of the caseload. So for some individuals on SSI, if they were to receive food stamps, they'd receive a greater level of benefit. For some individuals, and I believe it's generally disabled children living with their parents, they would receive a slightly lower level of benefit relative to how food stamps versus SSI shakes out.
But I mean, how much do you get? I mean, in other words, if you made $674 per month, how much food stamps are you eligible for? Is it more or less than $176? Or
I think
156
it's less, but
under
we
the
have
governor's
to go
proposal.
look at.
I mean, I'm starting to wonder if we've gotten down to the level where if you're going to bother to mess with this cut and try to get those savings, you just do away with SSP.
Let's look. We can't do away with
SSI.
We cannot do away with SSP.
Okay, now tell me why.
The federal rules are we must provide a grant level equal to what we were providing in 1983. If we go below that, our choice is to lose all of our Medicaid funding. So only if you eliminate Medi-Cal, then that becomes an option.
No, we don't want to do that.
Yeah.
I thought SSI was related to a different issue than
No.
Medi-Cal.
So we have a limit on how low you can take it. I think the question you're
Because
asking,
SSI
which
is 100% federal.
the SSI piece is 100% federal and the SSP is 100%
I see.
state.
So other states, everybody has to do something SSP if you take
You
SSI
got
at all?
grandfathered into whatever night you got locked into your 1983, whatever your grants were at that time.
Really?
That's what they did, and essentially, and I
And then
believe
we added
circa
COLAs to
95
it
under Wilson, we were back down at that. We got a higher because of COLAs that we were granting, and then as of a 95, we were all the way down at the floor. In the late 90s, during better economics times, we did grant some COLAs,
Right.
And then now we're going the other direction, and this proposal takes us back to that floor. I think on your food stamps question, we can certainly get back to you that it's usually looked to be not a cost-effective approach to essentially undo the cash out, because what happens is, although we would draw in
So
some
we
food
did actually
coupons,
just buy 'em
we would
out.
have a state. We also get we ended up opening a food stamps administrative case that we have to administer. Well, we have to pay our share of the cost of that food stamps case, and so
Yeah, but
the
food stamps are
general
100%
approach
But
again.
the feds pay for that too. So,
They pay
well,
part
we
of
do a
it. They
little
pay
bit.
part of it. We'll look at it one more time. But generally, when this has come up in the past, it's been okay. To the extent you're concerned about the benefit level here, you're better off either, in this case, would be not cutting or giving an increase rather than undoing the cash out. But we will take one more look at it. The federal American Recovery and Reinvestment Act did raise food stamps. It may be worth one more peak, but in general, it hasn't looked cost effective to do this.
Okay,
Ms.
in the past.
Monosanos gave
I
another
just-
reason why
I don't
too.
know. It's just these amounts are so low. When you're talking about people that are below 100% of poverty, I'm not quite sure how to
It's
think
really
about
hard.
cutting them.
Mr. Leno?
I think that there's value in looking into that further. If I remember correctly, when I took the food stamp challenge a year ago, that for a single person, it equated to about $1 per meal. So that was $3 a day, $90 a month. If you added that to the 176 or 156, it's going to bump you above what we were in January. So that could, and those would be federal dollars. I understand there'd be some administrative costs, but it could be of some value. And then I had a question, because it jumps out that single people will be at 92% of federal poverty level in the governor's proposal, and couples at 116%. So what's the concept here? We want to incentivize people forming families, stability, getting married. And that's what my next question is what's the determination of couple? Is this because it's federal dollars, it's the federal definition of couple? Are domestic couples included? Domestic partners included in this?
I don't know the answer to that question, but I'll get back to you.
There are very few things you don't know.
So we'll get back to you on the definition of couples. I think it's federal, but I'm not positive. And then it's been the history of the program, and one of the issues that has come up is the couples grant is less than twice the maximum individual grant. So one of the concerns that's been raised in the past about a reduction to the couples grant is the same.
Actually, couples being hurt. Yeah.
And creating, couples receiving more in SSI benefits if they divorce than they would if they remain a couple.
I do see that.
And in any event, the levels this is really reflective of history. We got locked into these levels in 1983.
Okay.
So,
well, if we determine that we have to follow the federal definition of what a couple is, I would appreciate if someone would contact Chief Justice Ron George, because in his rejection of the challenge to Prop 8, he said same-sex couples lost nothing as a result of Prop 8, and that would not be the case.
Okay, members, on this one, I would recommend that we leave this item open to get a little bit more information and answer to these questions. And we do need to break now. So without any and I am going to recommend that we reject the governor's trailer bill language to eliminate all future COLAs. I think that is something we need to revisit on an annual basis. So we're not going to take action on that, but that will be my recommendation. So we'll come back here at 3 o'clock, and we will start on page 20 with the proposal to eliminate CalWORKs.